Have you ever had trouble falling asleep or feeling well rested when you wake up in the morning? If so, then you might be suffering from one of the 11 types of insomnia. I myself suffer from insomnia and I find it incredibly hard to fall asleep at night. And most of the time, when I do fall asleep, it's 4 or 5 in the morning already. As a medical student, it is really important for me to have a good quality of sleep so I can excel in my studies. Insomnia doesn't just affect your sleep, it can also have daytime effects like fatigue, tiredness, lack of energy, irritability, reduced work performance, and difficulty concentrating, which all can affect your life in a negative way. According to an article from Medscape, 95% of people will suffer from one or more of the 11 types of insomnia during their life. By knowing the different types, you will be able to identify or help others treat their insomnia. The Diagnostics and Statistics Manual of Mental Disorders, DSM 5, groups these 11 types into three categories. The first category is transient insomnia. Transient insomnia lasts for less than a week. In this category, we have adjustment insomnia. Adjustment insomnia is also known as transient, short term, or acute insomnia. The causes can be divided into two broad categories: environmental or stress related. Environmental factors can include excessive noise or light, extremes of temperature, or an uncomfortable bed mattress. Stress related factors primarily involve life events such as a new job or a new school, deadlines or exams, or death of relatives or close friends. This insomnia resolves when the stressor no longer presents or the individual adapts to the stressor. Now that we have talked about insomnia, now let's talk about acute insomnia, which is the second category. Acute insomnia is the inability to consistently sleep well for a period or less than a month. In this category, first we have insomnia due to drug or substance abuse. This sleep disruption is common with the excessive use of stimulants, alcohol, or sedative hypnotics. The second category is insomnia due to the second type, is insomnia due to substance or known physiological conditions unspecified. This diagnosis is used for forms of insomnia that cannot be classified but are supposed to be the result of an underlying mental disorder, psychological factor, or sleep disrupted process. Next, we have inadequate sleep hygiene. Inadequate sleep hygiene practices are evident by the practice of one of the following: improper sleep schedule consisting of frequent daytime napping, selecting high variable beds or rising times, or spending excessive amounts of time in bed. Then we have routine of use products containing alcohol, nicotine, caffeine, and especially the period of time you go to bed. Next, we have psychological insomnia. This insomnia begins with a prolonged period of stress in a person's previous adequate sleep. The patient responds to stress with a lot of tension and agitation. In a person experiencing normal sleep, as the initial stress abates, the sleep habits are gradually extinguished because they are not reinforced nightly. However, in a patient with a tendency towards occasionally poor nights of sleep, bad habits are reinforced and the patient learns to worry about his or her sleep, and the chronic insomnia follows. Next, we have paradoxical insomnia. In paradoxical insomnia, one of the following criteria applies. The patient reports chronic patterns of little or no sleep most nights, with rare nights during which relatively normal amounts of sleep are attained. Sleep log data from one or more weeks is monitoring after show often show no sleep at all for several nights each week. Typically, daytime naps are absent following such nights. Next, we have behavioral insomnia of childhood. A child's symptoms meet the criteria for insomnia based on parents or adult caregivers' observation. Two types of this sleep disturbance are recognized: sleep onset association and limited setting. Now that we have talked about acute insomnia, let's talk about chronic insomnia. Chronic insomnia is chronic insomnia lasts for longer than a month, and in this category we have insomnia due to medical condition. This is insomnia produced by an underlying condition such as chronic pain from any case like cancer or arthritis. Then we had advanced chronic obstruction lung disease, benign prostatic hypertrophy, chronic renal disease, chronic fatigue syndrome, fibromyalgia, or any neurological disorder. Next, we have insomnia due to a mental disorder. Most chronic psychiatric disorders associated with sleep disturbance are depression, schizophrenia, the manic phase of bipolar illness, or anxiety disorders. Next, we have idiopathic insomnia. This is the sleep disturbance. This sleep disturbance is a long-standing complaint of insomnia with insidious onset in infancy or childhood with no cause. Next, we have primary sleep disorders causing insomnia. Included in this category are the following: restless leg syndrome, obstructive sleep apnea syndrome, circadian rhythm disorders, and circadian rhythm disorders. I hope that you can be able to use this information going forward. We have talked about the 11 types of insomnia and under what category they each fall, and explained the basic information you need to know about each one. I hope that by better understanding and knowing the different types of insomnia, you will be able to identify if you or a loved one is suffering from insomnia and be able to get treatment to get a better life quality. Thank you very much.